I wanted to go over blood gases. So when you get a arterial blood gas, you are going to find out pH, PCO2, bicarb, and O2, which isn't on this film. Normally, our body likes to work in a pretty narrow range. pH is 7.35 to 4.5, 35 to 45, and a bicarb level of 22 to 26. Of course, change our PCO2 levels. Our kidneys are the primary bicarb levels. Right? Metabolic. So when you have a situation where you have respiratory acidosis, your pH is low, your CO2 is increased, and your bicarb is normal. Now, as you start to compensate for that respiratory acidosis, your bicarb is going to increase. Okay? Some of the causes of respiratory acidosis are anything that causes respiratory depression. If you get someone that's taking a drug overdose, that sort of thing, COPD, pneumonia, where they're not able to ventilate very well. Remember, the CO2, when it's combined with water, becomes carbolic acid, so that's why it's an acid. And bicarb, sodium bicarb, remember that, is a base. Respiratory alkalosis is the opposite. Your CO2s are low. You're blowing off CO2 for whatever reason, and your bicarb is normal. Compensating for this, the bicarb, of course, is going to increase, but this does not happen quickly. This actually takes a little bit of time. So there's going to be a period of time when the pH is going to be high or low. Metabolic is pretty much the same. Your pH is low, but your CO2 is normal, and your bicarb is low. That's in diabetes, shock, renal failure, and you're going to see the compensation in the fact that your CO2 is going to increase to compensate. So when you think about metabolic acidosis and alkalosis, for acidosis, you think about diabetic ketoacidosis, shock, renal failure, overwhelmed sepsis, that sort of thing can definitely cause this. Alkalosis is sodium bicarb overdose, NG drainage, okay? This is diarrhea, okay? Acidosis, diarrhea can cause metabolic acidosis. So just kind of, there was one other thing I was going to talk about here. When you have metabolic acidosis, you can have something called renal tubular acidosis, which is a genetic. Typically, these people will just have a low-level acidotic state that's compensated. As babies, they just don't gain weight very well. Thrive kind of kids. That's why you want to go. If you have a kid that's not gaining weight, you definitely want to check a set of electrolytes at some point, like actually you want to check a thyroid level and then a set of electrolytes. On your set of electrolytes, your CO2 on there at your bicarb levels. Okay, so you do a set of electrolytes, you'll get sodium, potassium, chloride. So if your CO2 is low on your electrolytes, then you have an acidotic state. And all you need to do to diagnose this is check a urine pH. And if they're losing a lot of bicarb through you've pretty much got a diagnosis on. And to treat this, you just give them the bicarb. Anyways, I hope that helps a little bit.